model.
All right.
Yeah, there should be a point. And I think it's important.
So, how did that feel? Sharing your story, coming up with your chapter. How'd you do? It sounds like you had one. Yeah. How did it feel going through that process of identifying it, sharing it, picking out the lessons?
Sorry, what we're still talking.
How did it feel? Going through, identifying your chapter,
I thought it was.
pulling out the lessons, how you've applied them, the title.
I thought it was fun to do both, to think of my own, but also to ask. And it is nice because, you know, in this room we all have shared professional identity, maybe not all the same personal identities. So we talked about one story that was a personal identity framing moment each, and then we talked about, like, when did you feel like a real doctor? Like, what was that moment?
Cool.
There was like one or two patients where you're like, I did that. That was me being a doctor, you know, like not just playing one on TV, like we do when we first start as students. So I thought it was really.
That's very cool.
Yeah. But it was good that you asked that follow-up question, like with the patient story. Did that change your approach with future patients during your internship? Because you know what, I hadn't thought about that. I've thought about that scenario all the time, and I tell my residents, like, this was me being a doctor, even when my people with more experience told me I was wrong and I was right. And then I never took it a step further. I was just happy that I was not totally incompetent. And, you know, Dr. Josephson asked, like, well, did that change your approach moving forward during your internship? And I thought, you know what, it did. In times I had to argue with consultants on other patients because I'd had that confidence, like, wait, I do know how to make a diagnosis.
Yeah.
And I know how to defend my opinion.
Great question.
Yeah.
Powerful question.
You're a great coach.
In retrospect.
And so how did it feel doing the listening and the reflecting? How was that? Is that hard to reflect? Did you find it natural?
Took some work because then you have to like synthesize it and then say it back, but summarize it.
You know, and it touches on something in your childhood too. So then you're like thinking in your head, oh, I had that same, yeah.
Yeah.
You know.
And how to like touch on that without over touching on it.
Yeah, or just like, just suppressing that and listening to their story.
Yeah. But you realize how powerful it is to share some of these stories, and like and hearing them makes you really revisit some of your own.
Yeah, and I think like listening to your coachee talk about their fellowship and, you know, what they're going through, there's a lot of, similarities. You remember that stuff.
Yeah.
You just have to listen.
Right. Yeah. Pull back and just listen. Yeah.
Right.
And did the questions come kind of naturally for this one, also because they're just up there. But did you feel like it was a pretty natural dialogue once you got going? And so this tends to feel like we're just talking about ourselves. We're just two people talking about ourselves. And
The title felt a little awkward, I think.
the title.
That was
Yeah,
the hardest part for me
Yeah.
too. In fact, I'm still not.
And it can be a work in progress. It can be a manuscript in progress. But I think the title really solidifies the lesson. And I think that's why it can be a little bit hard, because you're like, okay, do I have to commit to one title? What if I want two titles? But I think what it really does is it solidifies it. You know, like for example, with the story that Rhonda was telling, it could be like when I became a doctor or something, you know, but it was like really something simple. Yeah, it doesn't have to be. Right. But I think what it does is it drills down on the lesson. Yeah.
And so this idea of like holding back, wanting to say like, I had that experience. So Carrie and I, during the practice session, when we were getting our coaching certification, we happened to get paired together on the phone. She had just returned from a yoga experience in Costa Rica. And as soon as she said it, I wanted to be like, oh my God, I loved my yoga trip in Costa Rica. Let's share. But that was making it about me and my experience. And so I really had to, especially because we were friends already, I had to bite my tongue and just let her bask in that glory. And later, of course, I got to share my story. But so it is hard at first, but the reason I'm telling you that is it becomes easier with practice. It really does, because like at first, as she was saying, reflections were really felt awkward and doing that, so many of them. And then the more you practice it, you're like, oh, this is actually less work for me. I'm just present with their journey, and they get to do all the thinking about answers to the questions, and I'm just reflecting back to them.
Yeah, I completely agree with you. So you'll have another chance now to practice. We're going to dive in. So this is chapters. The next one is crucibles. So crucibles are another type of chapter. But when you think about the turning point of the story, the part of the story that truly changed the person who emerges from the story, that's the difference between a chapter and a crucible. So we're going to walk through this, but basically the idea is that when faced with a crucible moment in our life, it heats us up at the core and changes who we are, either in shape, in form, in action, in how we identify. But the idea that, like I said earlier, the person who walks out of the story is not the same as the person who entered the story. And the idea is not to like really dig through the story itself, or as Carol loves to say, it's not about the drama or the trauma, and it doesn't even have to be a bad story. But it's about the transformation. It's about who emerged from that story. How does that story continue to play itself out in your life today? And that it really is not just a growth moment, but a whole change in your trajectory. And I'll give you some more language and examples of what this means. And so really the point of it is that it's so much more about the lesson than it is about the story itself. It's really thinking about the most formative of your chapters and how that's changed who you are. And the important thing is that no one can tell you what your crucible is. You could know someone their entire life and guess what their crucible or crucibles might be, but only they will know. So to give you an example, when Carol and I were practicing this, I had just come out of, or one of the times we were doing a training, I had just come off of maternity leave after being on bed rest due to horrific pain, like could not move, pain for months. That I knew I just had to get through until the baby was born, and then everything was going to be fine. And she was like, I gave an example, and I'll share with you the example that I'm going to give of my crucible. And she's like, that's your crucible? I could have sworn it would have been like being on bed rest. And I'm like, no, it's fine. I just had to get through and have the baby. That's all I needed to do. And like to me, that was maybe a chapter of like how I got through bed rest and pain. But it really was not that formative for me because it was just something I had to do. And there was a very clear like purpose for it and a very clear end. So we can't prescribe each other's crucibles. What's a crucible to somebody might be a chapter to somebody else. And the point is not necessarily like, describing the value of that story in and of itself, but really thinking about what is the lesson? How did you change? And like I said, I'll give you some examples. The one important thing, so the actual dialogue itself is very similar to the chapters, but the most important thing about a crucible is that it has to be over. Because if it's not over and you're talking about it, then you're their therapist. So it's like a major distinction that it has to be over. So if someone's going through a divorce, if somebody is processing the loss of something or someone, and that's what you're talking about, it needs to actually be over for it to be truly count as a crucible. So I'm going to give you a couple of examples because again, I think examples are helpful, and having your own is going to be helpful to them as well, and sharing your own. There's some good crucibles, like positive crucible stories, and some sad crucible stories that are now positive because they are over and there is the way that the person changed. So one very positive one is I was actually doing this at a training just a couple weeks ago, and one of the people there was like, I cannot think of anything. I cannot think of anything. And I talked with her about it the day before, and she's like, I have nothing. I'm like, nothing hard, nothing major. Nothing, no major anything. And she's like, I just can't think of anything. She's like, my life has been pretty simple and straightforward. And I was like, just keep thinking about it. And in the training, she and I were paired up together. And it went from like, I have nothing to realizing she has everything. And it was that realization of like this year had been like a really like banner year in a way, like lots of very positive things happened in her family, lots of positive things in her own individual career. And she realized in the process of going through this, like how incredibly grateful she is for all of these things that she has, but also realizes how really fleeting all of this could be, and that if she doesn't stop and actually appreciate these moments and this year and these opportunities, that she's going to come upon a hard time and have nothing to draw off of. And so for her, it was recognizing the real crucible moment, and she was like actively crying as she was telling me the story. And just like completely moved and overwhelmed by how grateful she was. And she said like she has never really had that gratitude moment before, and it was really recognizing the importance of gratitude in the smallest and in the biggest of moments. So that's an example of like a good crucible. I've had other people talk about, one of my coaches talked about the loss of a parent years and years and years ago. And she wasn't there. And she didn't respond as, she wasn't as aware that she should be there when it happened. And she always, but her other siblings were there. And she carried guilt with her for years, to the point where it actually like impacted some of their relationships, because she thought that they judged her for not being there. And years later, she was like, well, I know you guys feel this way because I wasn't there when Mom died. And they were like, what are you talking about? And she's like, well, I know that this is how you guys have felt. They're like, we literally have no idea what you're talking about. And she realized in that moment she had wasted years of her life, of their lives, with this guilt that she has put upon herself because she didn't speak up and she didn't share what she was feeling. And so she said whenever she starts to feel like something is piling up, she talks about it. She goes, maybe I do it too soon now. She goes, but I never leave anything unsaid anymore, because I realize what valuable, precious time I wasted. So it's an example of like a sort of more emotional crucible. You could have clinical crucibles. I told the story the first time we did this in training about how I was very scared in residency that I was becoming like not emotional and not personal. I think now in retrospect it was like that depersonalization part of burnout. And that I was just kind of like walking through the motions. And my sister had called me right before I was about to go. I didn't know I was about to go into a code, but she called me, and she was actually had just found out she had lost her first pregnancy, our like first grandchild in our family. And I'm like talking to her, and she's like in the bathroom at Target bleeding, like by herself in a bathroom at Target, and the code alarm goes off. And I was like, I have to go. And because I did, but you know, then I got lost in the code, and then I had to talk to the family, and then I realized I had all these other things, and then I didn't call her back for a few hours. And she let me off the hook completely. She, I know. I could hear all the alarms, but I couldn't let myself off the hook. And I was like, what has happened to me? Like, this is my sister, and I'm not connecting with people. And what's really interesting is this is the same one where that coach shared the story about her siblings, and her mom's passing. And I shared this story, and I was talking to a woman who had been my attending when I was a resident. And she was like, I hear everything that you're saying, but I will also know that like we shared a sick patient. She's like, you're the only person who would go in that room. It was so emotional, this patient that we had in the CCU. She's like, you were the only one who could go in the room and look those people in the eye. So she goes, you may have lost it a little bit with your family. She's like, but you haven't lost it as a doctor. And it was like, again, that weight just like lifted off of me. But to this day now, I carry with me, like, don't forget to be the sister or the wife or the mom or the daughter, and like the importance of like, it's not their fault that I chose this career. And that was like such a mark in my mind. Like I still, like it like brings me back to that. I could tell you exactly the floor in the room and everything when that code happened. And so these are like these really powerful experiences. And so the importance of the crucible, again, it's not really about the story itself, but it's about how it changed you and how you apply that now. So if we were to take the crucible that I shared with you, we could talk about, you know, so even just last night, I was like busy packing for here, and my mom was at the doctor. And she was like, I don't know what, and it was like the kind of like annoying questions I'm used to answering hopefully she doesn't see this recording, the annoying questions that like your parents ask you when they have medical stuff and they're not medical. And I was like, it's fine, Mom. It's like, and I was like, Carrie, watch your tone. And so I just stopped what I was doing and I was like, all right, what other questions do you have? Tell me what you need to know. And I just stopped because I just like kind of like walked myself like, you're doing it. And so, and tried to just always just show up, you know, and whether it be a phone call or checking in with somebody or calling somebody, just showing up and being there for them. And doing that for my patients as well and recognizing like that 5-minute phone call and what that does for people when you just show up emotionally. And so I think if I were to pick a title, that actually would probably be it, like don't forget to show up. Don't forget to be there. So, so how do you guys feel about thinking about your own crucibles? Do ones come to mind? If I were to pair you up, do you think you're ready?
Sure.
Sure? If one person in each pair has one, then we can start. What do we think? What about you guys? One of you guys have one? And if
I mean, this does seem more like therapy. I can't see, this is kind of awkward to talk about with your trainees.
it can be, depending, but they're not going to talk about something they don't want to talk about. And so that's the thing, like I wouldn't tell you that story if I wasn't comfortable telling you that story.
Yeah, I know, but you like warn them ahead of time? Or do you have to
Yes.
think of a crucible?
Yep. So they're in the email, provided they read it, it will talk about what a crucible is. And in it, it says, if you don't feel comfortable about talking about something in your personal life, find me a person who doesn't have a crucible story from residency. The first patient you had to call with cancer.
Yeah,
The first patient who said you were a terrible doctor. You know, whatever it be, everybody, the first attending who yelled at you. You know, or the first awesome diagnosis that you made on your own. Like it could be the highs too. That first time, you know, like I could tell you like a great crucible story from residency. Like on our match day from medical school, I helped plan like the party, and there was all this leftover champagne afterwards. And so all of us who planned the party took a bottle of champagne and we said, we're gonna drink this the first time we save somebody's life. Little did I know I would never personally save somebody's life. Like that's just like not a thing that happens in internal medicine residency. And so I every day would like come home and there was very little in my refrigerator as an intern, mostly condiments. And I would, which I overuse, yes. And so I would open up the refrigerator and I would see this champagne all the time, and it's sort of like hung over my head like, you loser, like your friends probably all drank theirs by now. And I had this patient that was soul sucking on my panel. That's like just the only way to put it. I mean, he was so draining. He was so complicated. He was so emotionally flawed and so dependent on substances, and like horrifically medically complicated, to the point where he basically like lived in the hospital. And I took care of him all 3 years, and all 3 years that champagne was still in my fridge of residency. And I finally realized he was never going home. But because he lived in the hospital, I literally knew every surgery resident. I knew every surgical nurse. I knew every pastoral care, every TPN person, every PT, every OT. I had to like run these family meetings and like whole team meetings as like a third-year resident. So little did I didn't see all these lessons sort of emerging from the care of this guy, who even had like a nickname that everyone in the hospital knew him. That's like who he was. And I went to Africa my senior year. I saw horrifically terrible things and illnesses that we would never see here. And came home and took one look at him, and I was like, you're never going home. So we could keep doing this, or we could think about how you want to live your life for the rest of the time that you have it. And so we ended up making him comfort measures only. He made a punch list that me and all the nurses on that floor helped him finish, of like his bucket list of all the things he wanted to do. I finally understood the term bucket list. And it ended, he had never had champagne before. And so we drank the champagne with him in the hospital. And I walked out of his room after he died. It was empty. And I walked away and I was like, that was what that bottle was for. That's what we did. And I realized all the lessons he had taught me. And that anytime I have a patient who is driving me crazy, I think to myself, what are they teaching me right now? What are they teaching me right now? Because of him.
Or where's the alcohol?
And where's my champagne? And now I love champagne. So that's an example. You could have really powerful ones from residency. So feel free to choose a clinical one. And if you feel like knowing your coachee that they're like never going to tell you about when their sister had a miscarriage in Target and they weren't there, then use a clinical example yourself. You know, or use a safe enough life example that they wouldn't feel like, how am I supposed to match that? And it is really powerful how the lessons emerge. Like you said, like I didn't think about how to apply it or how I apply it. So let's break up into pairs and see if we can work on your crucibles. All right, so I'll do 4. Did 4 minutes feel like enough? Too much? Okay. All right. So we'll do 4 minutes each again, and then we'll regroup.